Hello, my name is Dr. Dewan S. Raja. Today I will discuss about epidural hematoma. Epidural hematoma is caused by laceration of the middle meningeal artery or vein, usually the middle meningeal artery, which lies between the dura mater and the inner table of the skull. Usually the lateral aspect of the skull has a fracture, but it may happen in the posterior cranial fossa. Even epidural hemorrhage may also possible in the vertebral column. But the common site is the pterion area on the lateral aspect of the skull bone. And the artery commonly damaged is the middle meningeal artery. This hematoma means collection of blood. It becomes clotted a little bit. Okay, so it forms a biconvex clot and temporal bone fracture. These are usually found will get fracture to the temporal bone. Epidural hematoma sometimes crosses the suture line. Sutures are the fibrous joint between the skull bones. Classic presentation: initial loss of consciousness, lucid interval for hours, 2 days even, then neurological deterioration. But this classic presentation is not always present. It is present around 50% cases. Symptoms include headache due to contusion to the brain, progressive obtundation due to increased intracranial pressure, hemiparesis, ipsilateral pupillary dilatation, uncal herniation. These all are associated with increased intracranial pressure. Because of collection of blood in the epidural space, the space between the dura mater and the inner table of the skull. And middle meningeal artery is a branch of the maxillary artery. It enters the cranial cavity through the foramen spinosum, and middle meningeal artery, stem of the artery, is related to the pterion, where multiple skull bone unite. So we got the epidural hematoma and classic presentation, but that may not be present always. Symptoms include headache, and these all are happening due to increased intracranial pressure. Death may follow if the treatment is delayed. So what is the treatment? Treatment is removal of the blood clot and repair of the blood vessel. So we need neurosurgical decompression. Okay, so this is epidural hemorrhage. It will be clotted, so we'll call then hematoma. Okay, and this is located between the dura mater and inner table of the skull bone. Excuse me. We may also get fracture line here. Is a fracture line, and as because collection of blood, there will be increased intracranial pressure. We'll get signs and symptoms. On CT scan, we'll get a biconvex shape area of epidural hemorrhage, and the brain substance will be deviated towards the other side due to collection of blood in the epidural space. And this hemorrhage may cross the suture line sometimes on rare occasion. Now we go to the subdural hematoma. Subdural space is what? It is a potential space between the dura mater and the arachnoid mater. Okay, between the dura mater and arachnoid mater, no S. Okay, located between the dura mater and the arachnoid mater. Lacerated bridging vein is the cause of subdural hematoma, that is located between the superior sagittal vein, superior sagittal sinus, and the supercerebral vein. We have the bridging vein. These are damaged in subdural hematoma, and subdural space is a space between the dura mater and the arachnoid mater. It is correctable supratentorial mass lesion. Okay, more commonly elderly patient, but even it is also common in case of children, especially child abuse, shaken baby syndrome. Due to shaking of the head, there may be damage to the bridging vein, so not necessarily always the older person. Children may also suffer from subdural hematoma, especially in child abuse. It may be acute or chronic. It may be bilateral around 1/6 cases. Usually it is unilateral, but around 1/6 cases it will be bilateral. The hematoma is crescent shape, like a crescent, like a banana, crescent shape, okay, and does not cross the midline. So we got here epidural hematoma is convex, biconvex, like a lemon. Here subdural hematoma, just like a banana, like curve, crescent shape, okay, and it does not cross the midline. So what are the features of subdural hematoma? If you go here, acute subdural hematoma, history of head injury. So subdural hematoma may be associated with epidural hematoma. It may be associated with subarachnoid hemorrhage. It may be associated with intracerebral hemorrhage. Impaired consciousness or coma in subdural hematoma. Focal neurological deficits. Prognosis is poor if other cerebral hemorrhages or contusions are present. What is the treatment? Again, treatment, emergency craniotomy, removal of hematoma, and stoppage of hemorrhage. Okay, that means control of bleeding. Chronic subdural hematoma occurs in children or the elderly due to repetitive head injury or minor trauma. Children, suppose in case of shaken baby syndrome, child abuse, that may happen. Elderly person may fall repeatedly. Other risk factors include alcoholism, cerebral atrophy. In cerebral atrophy, blood vessel may be damaged very easily. Epilepsy due to convulsion, due to sudden increase in intracranial pressure. Use of anticoagulant that will increase the blood clotting time. Ventricular shunt, especially in case of hydrocephalus management. Long-term hemodialysis, another cause of chronic subdural hematoma. Gradual mental status changes. It goes slowly. The symptoms, headache and focal deficits. Treatment again simple, surgical bar hole and drainage of hematoma or a craniotomy. This is very easily done by the neurosurgeons. So this is our subdural hematoma. It does not cross the midline and it is crescent shape, or you can call it banana shape. Okay, there is some collection of blood here. Again, we'll get the features of increased intracranial pressure because substance of the brain will go to the other side and some part of the brain will go through the foramen magnum like uncus. Epidural, subdural and intercerebral hematoma, how can you compare? Epidural hematoma on the lateral aspect usually, and the rupture of the middle meningeal artery. Here the subdural hematoma is due to the rupture of the bridging vein between the supercerebral vein and supraparietal sinus. Okay, this is the intracerebral hematoma I'm saying here in the inferolateral part of the brain, on the brain substance, maybe in the temporal lobe. Okay, here Okay, and that's all about the epidural hematoma and subdural hematoma. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me. Have a nice day. Bye now.